Morning all. Today we are going to discuss regarding the fourth year BSc Nursing, Community Health Nursing, second chapter, that is nothing but Family Health Service. Before watching this video, I have sincere recommendation. Please read what all the content you have at least 2 to 3 times. Then you will get the thorough knowledge regarding this topic. Then we'll discuss about some of the main important points in this video. So you can see already you know what is the family development cycle, nursing process regarding the family, then back technique and home visiting. We'll see which all the question may chance to ask and what type of the question they may chance to ask in our last year exam. This is the model question paper pattern. Long essay 12 mark. According to my recommendation, try to complete within 25 minutes. Short essay 20 minutes. Short notes 50 minutes. And another one is answer briefly 10 minutes and differentiate within 5 minutes. Then after that you will get at least 10 to 50 minute balance. So which all of them answer you didn't write proper, you can write last. So this is my just recommendation only. You can take decision according to your teacher's advice. Long essay in model question paper, they asked what is define family, discuss the functions of family in health and illness, and last one explain the family nursing process. 1 plus 3 plus 8 is equal to 12. So here we are going to focus on 8 mark question. What is the family nursing process? So before that, first you write one introduction. Then we are going to write what is family. Family is a group of person united by the ties of marriage, blood or adoptions, and living together and eating from the common kitchen. This family term is derived from the Roman words. And what is the role of family in health and disease? This is just point only. Actually, up to birth of child to up to death, the modification of every child and every personality have the important role in family. Child rearing, socialization, personality formation, care of dependent adult, stabilizing the adult personality, family susceptibility to disease, broken families, problems of families. Here, this is one foreign article. According to this article, the impact of marriage and children on adult healthy behavior. Being a married or having the children affect whether one engage in healthy behavior. That Lewis found that married people were healthier than single, widowed, or divorced. This is one study conducted in Lewis in 1979. Then another one, the impact of family on children's health behavior. Family also influence children's health behavior in several ways. Several international studies in 1992 have found that the health programs aimed at decreasing smoking and engaging in dental hygiene were more effective when parents were involved. There's a different studies we can see regarding these all things. And another one, the impact of family on other family members' healthy behaviors. Every family members can influence other family members' health attitudes and behaviors through communication. As stated earlier, conflict among spouse can affect the physical health. The research on mental health has shown that critical comments from family members predict the chance of relapse in depressions, eating disorders, and schizophrenia. That is also 1999 and 1992 studies based. So one thing here we can conclude, up to the child born to up to death, the health of person, health of healthy practices, habit, everything the family have been the important role. That's why whenever we are writing the care plan, we have one point is a family care plan. So family have important role to not only modifying the behavior, to follow the healthy lifestyles, and to make the physical health, mental health. In last videos we have discussed the physical health are related to mental, and it is related to spiritual, it is related to social health. So family have the integrated part of the health of each individual. That is my conclusion. So that same only here we are discussing the family is a basic social context in which healthy behavior are learned and performed. That is also one study base. Research in several different countries has found that families directly or indirectly influence one's mental health, physical health, drug usage, diet, exercise, dental hygiene habit, and sexual risk taking behavior. The influence lasts as a lifetime. Okay, then next we'll see what is a family health nursing process. That question they asked in 8 mark. You just remember first define one, then next one 3, and last nursing process, family nursing process, they given 8 marks. So we'll see what is the definition of family health nursing process. It is a systematic approach to help family to develop and strengthen its capacity to meet its health needs and solve the health problems. We need to underline one word, health needs, to meet each family member's health needs and solve the problem. That's why we are forming the family nursing process to solve the health problems. Okay, we'll see the same step: assessment phase, planning phase, implementation, and evaluation. In assessment, we are assessing same optimum health, family lifestyle, environmental factors, family structure characteristic, etc. So one thing you should remember, the family structure, that environmental lifestyles, their culture norms, everything will be depend upon their health and healthy practices. So we need to assess these all things thoroughly. Then there is a step plan for data collection methods and technique, analysis of data, and family profile and diagnosis. I'll tell you one clue. You just remember how you collect this all data, or how you collect this all things in community health nursing posting. So you can write this all things in Pakka. Otherwise, if you are writing based on these notes, you may chance to forget some points. So please try to remember what all are things you done in community posting. Then based on that, you write here at least one example. You can earn more mark. Okay. So data. Next one is a data collection method and technique. In that, first one is the observation. First, what we'll do in community posting, we are observing the house and housing environmental. Then we'll ask the question regarding family members about their problems. Then another one, questioning. That's same, conversation and discussion. Actually, with the conversation or open conversation, we'll come to know what exactly they face. Because in first conversation they won't open. So really we need to maintain a good interpersonal relationship. Then only we'll come to know what they exact face, exact their problems. Then another one is a listening. The good listener only success in the to make a good nursing process. Then review the family health records. We should be ask them, and we need to check any family history, genetic problems, or anything else. Then examination, as usual, investigation, interview. Then guidelines for data collection, how we need to collect the data. Be systematic. Do not force to get information. Explain the reason for data collection, why we are going to collect. ensure confidentiality. This is one of the most important things, because the most of the persons are not sharing. Suppose maybe you have experience, whenever we are asking economical status, they won't tell real how much economic or how much income they have. So one thing you should make it sure, the confidentiality, that is a more important. Be polite. Don't let the family feel small and embarrassed. Make them comfortable, sympathetic, and listen alternatively and meaningfully. Record all the data without loss any one point. Then analysis of data, it should be categorized as a health deficit, health threat, and forcible crisis situations. Health deficit, failure of health maintenance and development, diagnosed illness, deviation in growth and development, personality disorders. The possibility health threats are large family size, it may affect in family economy also, lack of education, immature parents, broken family, poor environmental conditions, poor sanitation, environmental pollution, incomplete immunization, and unbalanced diet. Forcible crisis situation, anticipated periods of unusual demands on the family or family in terms of adjustment. They are marriage, pregnancy, newborn, developmental stages, new job, death, changes in residence. Nowadays, the one of main crisis is the corona, right? Then family profile and diagnosis. Family profile implies a brief descriptions of the family structure and characteristic, family lifestyles and culture, socio-economical condition, environmental factors, health and medical history. Family health diagnosis is the return statement of family health problem. What is family health diagnosis? It is the return statement of family health problem, which are assessed from analysis of data collected. Then planning phase, second place, planning phase. It is based on diagnosis. Steps of planning phase is nothing but first one, analysis of diagnosed health problems and assessment of family's ability to resolve problems. Second one, establish priorities, setting goals and objectives. Then fourth one, formulating family health and nursing care plan. Analysis of diagnosed health problems and assessment of family ability to resolve the problems. That is second assessment. Ability to recognize the present health problem, ability to make decisions about appropriate health action, ability to provide deserved care to the sick, disabled, ability to maintain environmental conducive to the health promotion, maintenance and personal development, and ability to utilize community for health care. Establishing priorities means ranks orderly of the health problems. We need to arrange, or we need to prior based on health problems. Then criteria for setting priorities, types of problem, first one. Then second one, severity of consequence of problems. Criteria of setting problems, first one type of problem, and second one based on severity. Then another one is the modifiability of the problems, salience of problems, and preventive potential. Then how we can setting the goals and objective. The mainly first thing is based on client focused goal or family focused goal, or that family member focused goal. The next one, community needs focused goal. The community health needs has to consider the available resources. First one, family resource, physical, intellectual capability, physical facilities and finance, etc. Then community resource, health program, community organization, etc. The nursing resource, her or his competency, time, support, etc. This resource is important to the proper implementation of the any nursing process. Then action phase, review of plan and mobilization of resource, implementation and documentation, give give adequate information. Then last one, evaluation phase, mainly two types. One is quantitative and another one is the qualitative. In quantitative evaluation, it determines the extent of service rendered to the family, how much extent the service got that family. It account the number of visit, clinic visit, number of immunization complete, reduction in mortality and morbidity. Next question we are going to discuss. So here we are conclude the nursing process, and we are evaluating how much that problem, how much that processing is effective, or how much we are that what all the implementation intervention we did that is effective for the family, that we need to assess thoroughly. Okay, next question. Still, actually, this is the new topic and the new syllabus is begin. That's why in other question paper I didn't see any of the question, but in my concept and my idea, just I make some of them point also. So 5 mark in my prediction, family development cycle they may ask. So one thing you should remember, before writing family development cycle, you should write what is family. If you know definition, that's good, and write some of the point in introduction section. Then only you can write the family developmental cycle. Okay, so there is a 6 point is there. First one, formation. Then second one is the extension. Then another one, complete extension. Then another one, contractions. And another one, complete contraction. And last one, dissolution. In formation, marriage is begin up to first child. Then extension, first child to birth of last child. Then complete extension, birth of last child to first child leave home. Contraction, first child leave home up to last child leave home. Then complete contraction, last child leave, first any family member, husband or wife dies. Then dissolution, first spouse dies or first any of the family member die, husband or wife it means. Then last who are the not die, that person also end. That is the one family cycle will be over. We can see another one more diagram also. It is a unattached young adult going to the newly married couple, family with the young children, family with the adolescent, launching family in later year. This is another diagram we can see in some of them social media. This is a family lifestyle, and write one conclusion also. Then another questions, there is a chance, importance of counseling in family health care. Here one thing you should remember, before we have discussed already what is the importance of family, or how family have the important role in the healthcare systems of the each individual. If it possible, please mention that point with what is counseling and what is the role of counseling in family. That family therapy is a method of treatment in which family members gain insight into the problems, improve communications, improve functioning of individual member as well as family as a whole. This is a basic concept of family therapy concept. Counseling, it is the treatment of family members gain insight into the problems, improve communication. In every family, issues based on there's a improper communication. They can't talk in openly. If whenever they are going to talk openly, there is argument, selfishness, ego, etc. It will come. So that is the mainly focusing on family therapy. Improve the communication, improve the functioning of individual members as well as family as a whole. If this concept will come, that counseling will complete. Family is a integrated part, or family, each member is integrated of that family well functioning. There is no separation in any of them. There is a no differentiate any of them. That is a basic concept of family. Each of them have own role. Like a one body won't tell any of one part, you won't do that function, right? I will never tell here you don't do any of the function tomorrow onwards, because whenever ear function will be imbalanced, it will affect the whole body. Like that, in family also, each members have the important and valuable function. That is the main aim we need to be introduced in the counseling. So, counseling is one of the approaches most frequently used in health education to help individual and family. When it is applied in health matter, it is a health counseling. The concept of definition: counseling is a helping process by which we first understand the problem and then help people or family to understand their problems, and then we need to work together with them to find solutions that is appropriate to their situation. Then approaches of family therapy: first one, integrated approach, psychoanalytical approach, bonds approach, structural approach, interactional or strategic approach, and behavioral approach. This based on John's theory 1980. Then family counseling training. In order to this, who can do family counseling training? There is no need for us. So one thing you should remember: the family counseling. Why counseling is important to the family? This counseling will help to make a bond relationship within the family members, or it will help to solve what are the problems they have. That is a basic concept of the family counseling. So write one conclusion also after writing all points. Next, two points is there. One is the expecting 4 mark question: home visit. Already all of them know what is home visit. Home visiting is defined as the delivery of specialized nursing care service in the home care setting. Home visiting is a process of providing nursing care to patient or family at the doorstep. That is important. Providing care in the doorstep. Next one, what is the purpose? The protection against disease, provide essential treatment, provide comfort and relief from pain to the patient, giving support and empathy, using domestic equipment for the nursing, providing health education, giving as much as respect as possible to the faiths and belief of the family during the procedure. And nowadays we can add palliative care also we are providing in the part of home visit. And what is the principle of home visiting? This is one of the important point. Home visiting should be planned with the purpose. First one. Second one, the purpose of home visit should be clear, must meet the needs of the patient. Third one, home visit should be regular and flexible. Then another one, home visit should be educative. Then home visit should be give excellent opportunity for nurse to demonstrate hygiene practice. Sixth one, home visit should be convenient, acceptable, and educative to the patient. Next one, the nurse should make an attempt to include each family member while using nursing process. Then the nurse and the family must develop positive interpersonal relationship in their work to achieve the goal. Then the nurse must respect the patient's right. And last one, home visit should be recorded in the diary or whatever recorded and family folder. This is a basic principle. Everybody should be by heart this, not by hearting. Everybody should be study thoroughly these principles of home visit, because the community health nursing need to complete with this visit. So please try to study these principles of home visit. Then components: initiative phase, beginning, pre-visit activities, activities during home visit, procedure and all, termination phase, and post-visit the activities, that part of the evaluation. Next question we are expecting in 4 mark, back technique. Community health bag is the vehicle for carrying the tools needed during a home visit. Or community health bag is a carrier containing the tool, equipments and material needed during the nurse visit to home for performing nursing intervention, which include various diagnostic tests, demonstration of care and patient care activities. Definition: back technique refer to the skill and knowledge in preparing and using the material and equipment in the in community health bag for performing various nursing intervention at home. Next one, principle. There is a three principle is that the use of bag technique should minimize, if not totally prevent the spread of infection from individual to family, hence to the community. Second one, bag technique should save time and effort on the part of the nurse in the performance of the nursing procedure. Last one, bag technique should not overshadow concern for the patient, rather should show the effectiveness of total care given to the individual family. If you know the pakka point, please underline like this. It will help to gain more mark. So this is the three principles of the bag technique. Then another principle of cleanliness, principle of sterilization, principle of protection after care, principle of improvisation, principles of restocking and principle of economy of material and time. So this actually full second chapter is covered, this slide and this video. So please study thoroughly. Best of luck. Thank you.